stand by. Our news conference will begin shortly.
Good afternoon, everyone, and sorry for the delay. It was some technical difficulties, not in this room, but outside of this building. So a little late starting today, and Minister Hagee will be in the House of Assembly. As you know, that's open again today. So begin today's update by turning it over to Dr. Janice Fitzgerald.
Thank you, Premier. Good afternoon, everyone, and thanks for joining us today. Since the media advisory yesterday, we have no new positive cases, and the total number of cases in our province remains at 261. 257 people have recovered, and in total we have tested 14,717 people. So while I cannot speak to individual cases for privacy reasons, I would like to clarify how recovery of a person hospitalized with COVID-19 is determined. People hospitalized with COVID-19 are considered recovered when they have resolution of their fever and their respiratory symptoms, and once they have 2 consecutive negative tests at least 24 hours apart. Sometimes people who have recovered from the virus may remain in hospital for other health-related reasons, but we will only be reporting on hospitalizations that are specific to COVID-19. So we've quite successfully made it through another week in our province with no new cases of COVID-19. And this is, again, very good news that would not have been possible without our combined efforts and dedication. It was very nice this weekend to see people out and about enjoying the summer-like weather with loved ones and friends on restaurant decks and walking and biking or enjoying a picnic in the park. It was also a good reminder that while COVID-19 may be with us for the foreseeable future, there are many things that we can do and enjoy as long as we take the right safety precautions to keep one another safe. While we continue to move about more freely in Alert Level 3, our provincial life with COVID-19 plan, let people, space, time, and place be our mantra as we safely resume our lives and daily routines. We know the greater number of people we interact with, the greater the risk of spread of COVID-19, and that physical distancing is imperative to reducing our risk of contracting the virus. We also know the longer the amount of time spent together, the greater the risk of infection, and that it is less risky to spend time together outdoors than it is to spend time together indoors. In addition to being mindful of people, space, time, and place, we must also continue to diligently practice good cough and sneeze etiquette and hand hygiene. Stay at home when feeling unwell and maintain a safe physical distance of 6 feet or 2 arms lengths from others when in the workplace or public spaces. When keeping a safe physical distance is not possible, wearing a non-medical mask can serve as an extra layer of protection for those around you, especially those who are more vulnerable to the severe effects of the disease. Please be mindful, though, that not everyone can safely wear a mask for health or other reasons. Therefore, when we see people without masks in public spaces, let's refrain from judgment and instead show compassion and understanding, as it is impossible to know the personal circumstances of those we encounter. I would like to advise today that the Canadian Red Cross has recently launched a phone-based friendly calls service in Atlantic Canada for people feeling isolated or lonely due to COVID-19. This service provides regular pre-scheduled calls to individuals as a routine safety check and to reduce loneliness, and connects callers with local resources when appropriate. If you or a loved one is feeling isolated or alone due to COVID-19, you can contact the Canadian Red Cross by calling 888-729-0144. No, it was 1-833-729-0144. My apologies. It's Monday to Friday from 9 a.m. to 5 p.m. Island time and 8:30 to 4:30 p.m. in Labrador to arrange a call from a trained staff member or volunteer. And this service is available in English or French. That's what I get for being vain. As a recap, for those who may have just joined us, we have no new cases since yesterday's media advisory, and the total number of cases in the province remains at 261. As businesses and services reopen in a modified way and we adjust to our environments and the enhanced safety measures in place, please continue to be patient and respectful of staff and fellow patrons as we navigate this new territory together. The kindness and goodwill we have shown throughout this ordeal is just as important as ever. And I applaud the work of businesses who have taken every precaution necessary to reopen to the public, just as I applaud the support and cooperation of the public for following the measures in place. I'm confident this mutual respect and understanding will continue to serve us all well. So together we have come a long way in this pandemic, and with our continued collegial spirit and determination, I know we will successfully see it through. So hold fast, Newfoundland and Labrador. And thank you.
Thank you, Dr. Fitzgerald, and great for a little touch of humor on this Monday as we start this week. And first of all, I also want to say thank you for your patience in the delay of today's update. Day 18, as Dr. Fitzgerald said, no new cases. This is a good start for the week. And, you know, this will continue as long as we follow the health guidelines and always reminding ourselves to stay within the bubbles, wash our hands frequently, physical distancing from others, and wearing a mask when you can't safely do so. So follow these guidelines, and this will keep us in good standing with this virus. And I can say once again that we are doing a really good job in keeping COVID at bay within our province, but all of this is accomplished by everyone working together, and when we do that, we know that we can keep it this way. I would be remiss if I didn't acknowledge that this is supposed to be Public Service Week. A week that would be typically come together in celebration. We would hold a main event in the lobby of Confederation Building to recognize the awesome employees that we have that work within government. And over the years, since my involvement with as an elected official within our province, I got to say, I've always been impressed with the dedication and the drive of our public service employees. And there's been no greater example of their hard work than during this pandemic. Now, over the past several months and in the face of uncertainty with COVID-19, it has brought to us our public service has remained committed to working on behalf of Newfoundlanders and Labradorians. Our public service has faced challenges, embraced change, and they've used innovative ways to connect and work with our public and our colleagues. So we once again want to recognize the great work that they've been doing. It has been an unprecedented time for them. The efforts of our public service make sure that residents continue to avail of the critical programs and services. So on behalf of each and every one of you, I want to thank our public service for the great work that they do. Please stay safe. Let's work together. Let's look forward to a time when we can actually formally get together and celebrate Public Service Week again and properly acknowledge you for the vital work that you do. Now, when talking about vital work, we have seen many employees who have been essential in delivering services and support to the residents throughout this pandemic. And since the onset, we have been working very closely with the federal government, as you all know, to put supports in place for families, for businesses, and for industry. Now, while we have spent some significant time working to keep you safe and have spent considerable time working extremely hard to protect your economic and your social well-being, the work we have done and will continue to do so is to help ease the burden and alleviate the stress of this unprecedented pandemic. So between myself, our ministers, our officials, we have daily discussions with our federal colleagues as we continue to work together to inform and develop programs and supports. It's not hard to see the results of this work. Later this week was announced by the Prime Minister today that you will see the Canada Emergency Response Benefit that will be extended and potentially into, I think, around October 3rd of this year, with December the 2nd as being the last date where you can get retroactive pay back to March. Now, provincially, we're putting in place a number of measures, and I think many of you would be aware, at least those within the industry of tourism and hospitality support program. That was a nearly $25 million program that we just recently put in place, and that was on top of and complementing the federal program as well. The residential construction rebate program is getting significant take-up. This is a 25% rebate on renovation programs. These are for residential properties or primary properties. So if you're going to spend up to $40,000, you can get a $10,000 rebate. Of course, that can be all prorated as well. This is really a way to help stimulate the construction industry in our province. And this also applies to the new home construction. And in addition to that, it's the $70 million in child care services. And this was really to support our essential workers early on into the pandemic that would need to access the child care program. And this was $200 per week per child for essential workers. It was a generous program. A lot of people look for Newfoundland and Labrador to model their childcare program. This was one of the best and most generous that you would see within the country. Again, just last week, we announced $9.6 million to create and develop forestry sector products. And from the very beginning, we have been recognizing the amazing work, the dedication, and the resiliency of our essential workers. They have provided safety, stability, and comfort at a time when nothing was ordinary. And this is why I was pleased to provide details on the COVID-19 Essential Worker Support Program this morning alongside Minister Osborne. And for those who might have missed some of the details, again, it was a program that was some $64 million, and 80% of that was funded by the federal government. It will support some 43,000 Newfoundlanders and Labradorians who were working through Alert Level 4 and Alert Level 5. So these are people that stepped up in a big way in the early days of the pandemic. So in partnership with the federal government, we will provide one-time compensation. It's a top-up for those lower wage employees. So the payment will range somewhere between $600 and $1,500, which varies by the number of hours that you would have worked through this pandemic. And this will be for residents who meet the eligibility criteria, who work in jobs that the federal government had identified as essential services or functions. So this pandemic has shown that the term essential has also changed, and it doesn't not necessarily apply just to first responders and those who work in healthcare. It's much broader than that. It's a wide range of industries that people rely on every day. So this could be in healthcare, as I just said. It could be those that worked in home support services or long-term care homes or personal care homes. For those of us for those that work in the electricity industry, making sure that the utilities and the electricity systems were maintained and working. And also an example would be for those that worked in the information and communication technologies. Wireless internet and communications, that infrastructure was extremely important in the last few months, keeping people connected. For those employees that work in banks, they're included in this program as well as food service, such as employees in grocery stores. It was very critical that we keep that supply chain moving in recent months. Those that maintain drinking water systems, could be taxi drivers and those that help support the transportation industry. Also, safety workers were included in this, people that answered the 911 calls at call centers and those that are managing medical waste and more. So it's a broad range. And also for those that work within government who help maintain government buildings. Employees in manufacturing are included as well. So there's an exhaustive list. So I encourage everyone who thinks that they might qualify to ask you to visit the Public Safety Canada website for more information. The Essential Worker Program, Support Program is about recognizing what was a very diverse range of essential workers who went above and beyond. It recognizes their support in providing critical services during the pandemic. So on behalf of the provincial government, I want to also thank our essential workers throughout Newfoundland and Labrador for their support of our government, commitment to the people of Newfoundland and Labrador, and keeping the residents, the services provided, and staying in good health. So to all the residents of the province, I appreciate your remarkable efforts to flatten the curve. As you know, as a province, we have weathered many difficult events in our history, and I'm confident that as Premier of this province, we will emerge from this pandemic as strong as ever. And we will do this together. One organization that has a deep meaning and working together is to support communities and families is the Rogers family. So I'm sending them a little bouquet and a thank you today for their donation of almost $2 million to help the most vulnerable in our province that have been impacted by COVID-19. The funds will be dispersed to a number of organizations to make an immediate impact and help ease the burden of those that are in greatest need. And some areas could be, in this donation from the Rogers family, would be Food Banks of Canada, so nearly $325,000 that will come to Newfoundland and Labrador to support the bulk food purchases and so on. Also, which is an interesting component to this, is how they would work in collaboration with the agriculture communities. And this is really about food production and food security. Women's Shelters Canada, it's another group that will see a benefit here in our province of some $225,000. And this will be used to support the development of training programs to help shelters serve marginalized women. So all good programs. The Salvation Army will be included as one of those that will receive money from the Rogers family. Of course, the Salvation Army heavily involved in food banks and shelters across our province. There will be some support there for Children's Aid Canada. Homeless shelters will receive some $500,000 from this program. Also, youth organizations in Newfoundland and Labrador will receive $500,000. So we want to thank the Rogers family for stepping up and supporting Newfoundlanders and Labradorians. Before I conclude my remarks today, I want to provide an update on some of the travel exemptions. Since May 4th and June the 14th, so about 5-6 weeks, we have just over 6,300 approved requests. So these are 6,300 people that will travel into Newfoundland and Labrador under the exemption order. And we know many families are looking for reconnecting and easing those restrictions, but I want to make sure that people, before they travel, will go to the COVID website, make sure they follow the travel guidelines that are in place. And this will help guide you through the information that will be required on the exemption order. Our business response team has been very supportive of businesses as they've been reopening up in Newfoundland and Labrador. Almost 1,300 inquiries have been dealt with now in a few weeks. There's just 27 inquiries left to be reassigned. So it's a fantastic group of people working there on your behalf. The hospitality support program that I just mentioned already has had some, in about a week now, from 472 applications, and they're working away there, getting the money into that industry. So there's lots of great work happening behind the scenes in our province to support and guide you through this pandemic. And certainly as we further ease restrictions and adjust to a new normal, I encourage you to stay safe. People, space, time, and place sounds great to me, and I encourage you to make sure that if you're out and about and you're just practice those health guidelines that have been put in place. They're there for a reason. They're there to protect you and your family. We will now open it up to the media for questions for today.
Thank you, Premier. For the benefit of our speakers, we have 5 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related topics should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Please do not press star 1 until your name has been called. Our first questions today are from Peter Cowan of CBC News. Please go ahead.
Premier, you mentioned the travel restrictions. The Northwest Territories has dropped their restrictions on non-residents entering. They say that it's unconstitutional. Are you reconsidering the ban here?
The ban itself is, within the consideration of the ban is when we see that Newfoundlanders and Labradorians could actually travel safely. So right now you raise the issue of one of the territories. We still have 2 of those territories that would still have travel bans in place with isolation, 14-day isolation plans, as well as about 5 provinces right now. So it varies as we move across the country, how freely you can move. And this ban that's been put in place, those restrictions on travel, were put in place at a time so we could protect Newfoundlanders and Labradorians. And when we working with public health officials, when we feel it's safe to travel into Newfoundland and Labrador, these travel bans and other restrictions will be things that we could consider at that time. But right now, it's let's learn to move around a province safely.
I want to ask about personal care homes. I've talked to family members who have loved ones who need to get into a personal care home. Their situation has deteriorated over the last few months. They've been told that can't happen, even though there's empty beds, if not allowed. If we're allowing visitors into long-term care homes, why are we still restricting those homes from taking new patients?
For the information on that, and this only would come from, some interaction that it would get, from residents, no different than yourself, but I didn't realize that it was a policy that people could move in. I know the assessments and all those services that would be attached to a resident moving in. I think from what I gather, they're still in place. I think there's a level of testing of the potential resident would want to move in if there's vacancies available. So from an assessment point of view, from the testing point of view, those mechanisms are still in place. So this could be something that's attributed to a local homeowner. Would know the specifics of the question you're asking, but the process of moving people or moving residents into personal care homes. I thought that practice was available. We can check on that for you, Peter.
Sounds good. Or I'll ask it again on a day that the health
Yeah.
minister's there in his bailiwick. Dr. Fitzgerald, a question for you. When we announced the alert levels, there wasn't much detail about what alert level 1 will look like in the province. If all goes well, we could be weeks away from that. Can you describe what do you see life being like at alert level 1?
Alert level 1 really is life living with COVID, finding a way to live with COVID before we get a vaccine, right? So we can't really leave alert level 1 until we get a vaccine, and there's good uptake of that vaccine by the general public so that we have some good herd immunity, so to speak. But it's so I think we will still see many of the public health measures still in place, such as physical distancing, hand washing, all of those things that we've been talking about up to now, trying to keep your contacts as your close contacts as low as possible, people outside of your bubble, trying to keep those interactions as infrequent and as short as possible. So that all of those things will still be going on. We will still be recommending that because we know that especially physical distancing is the one big thing that really has helped with the delaying the spread of this virus. And certainly we expect that this virus will circulate in our communities again, and we have to be prepared. We don't want to have to go backwards. We want to learn how to be able to live with this virus, and so we want to be able to keep moving forward and to have a way that we don't have to lock down again. We want people to be able to learn the right way to be able to deal with this virus. So I hope that's what we'll see at level 1, is that we're all, able to carry on most of our daily activities while still bearing in mind how we need to keep ourselves safe with regard to the COVID-19 until we get a vaccine.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Dr. Fitzgerald, this is for you. If we are to head into alert level 2 next week, as you mentioned last week could be a possibility, when can businesses that are allowed to operate in level 2, when can they expect to see guidelines?
So we're in the process of doing that as we speak. Our team has gotten together on a few different occasions, a big meeting this morning, just to make sure that we are on track to have those guidelines. And certainly we want to engage with some of those businesses to see what their plans might be. I mean, a lot of businesses will have, guidance from provincial or national bodies that would offer them advice as to how to do things safely. And certainly that's a great place to start. So it's about us engaging to let people know what the expectations are with regard to physical distancing and things like that. And but when it comes to how to make that work, obviously, different industries will have to. They know how their industries work and how they can make that happen. So we'll be looking for some feedback from them as well.
Perfect. And Premier Ball, this is for you. In terms of the essential wage top-up, how does government justify the 10% payment to employers to compensate for the extra payroll burdens of applying for the payment when you give it, like places New Brunswick are offering, up to 20%?
Yeah, so when you look at from an employer point of view, if they were to do the administration, there's a number of taxes and wage costs that would actually attribute the writing of that paycheck, to the employer. These could be, the employee's portion of the EI premiums, Canada pension premiums, workers' compensation premiums, and so on. So working with the number of employers and working with the Department of Finance, it was decided that, in Newfoundland and Labrador, that about 10% of that would be attributed to the employer component. That would be the extra costs. And this was meant to be cost recovery to the employer, not to put any hardship or any extra cost to them. It was just to support them to get this money facilitated to their employees. So this was not something for the employers to make money on. It was a way to facilitate getting the money into the hands of their employees who have stepped up during this pandemic.
And I'm kind of going off the back of Peter's question in terms of travel restrictions, when we look at what is in place here in Newfoundland and Labrador, and as we move through the alert levels, with the prospect of alert level 1 being a possibility this summer, are we not looking at the travel restrictions and if they could be linked to being lifted with one of these levels?
So there's a significant amount of monitoring that goes on that occurs behind the scenes and watching what's happening in other provinces, watching and monitoring the capacity that we would have within our healthcare setting, the availability of testing, the availability of PPE, making sure that you have proper contact tracing available. So there's a number of indicators that you must always be mindful of. Is, when you look around, the world right now and you see what's been happening as economies open up. I mean, we all want to get as back to close to normal as possible, recognizing it will be a new normal. But, when you see the news coming out of the U.S. around Florida, California, we see Arizona, Texas, and so on, a number of other jurisdictions that have moved up with, probably not making sure that, the proper provisions were put in place. All we're trying to do here now is to do it very strategically, making sure we do it carefully as we start lifting travel restrictions and so on, making sure that people could travel around our province safely. We want to get there, but in order for us to get there, we must be always aware of what's happening around Newfoundland and Labrador, and we always must keep health and safety first and front and center in the decisions that we make. It is about public safety. Finding that balance is important, but we do not want to find ourselves in a situation where we fall back into an alert system, and the impact that would have on the economy would be tremendous. So it's always about finding that balance. I know people are getting excited and people want to move around more freely, but I also hear from many, many people that are concerned about not doing this too fast and therefore triggering a setback, which would cost us the economy much more than what the restrictions are doing right now as we move out of this slowly and strategically.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi, I'd like to ask about travel exemptions as well. The amount you mentioned, I'd like to know what percentage of the total applications that is, but more importantly, how many are reversals of previous rejections? What percentage of rejected applications end up being granted an acceptance on appeal?
Yeah, so we started with the bigger number, of course, all the applications that would come in. Then you work down through a process. There is an appeal process that will be here. So somewhere now, the last time that I looked at numbers, which would have been late last week, around those that would have been denied, around 12 to 13%, I think the number was. It was down as low as 8%. I don't know where it is this morning. There's a tremendous volume of work that's going on by a group of people at Public Health. The public health officials that monitor this. So I don't know if Dr. Fitzgerald would know what the denial rate would be today, but it's relatively low. There's a lot of people, as I just mentioned, over 6,000 people that have had exemptions orders that have been put in place since early May to where we are now. So quite a few people are getting in because they're filling out the proper information that's required on that exemption order. So sometimes it could be that not all the information is provided. They have to go back to supply more through the appeal process. But there's a small number of people that are being denied. Most people are getting into the province through that exemption order.
Right. And I would add to that the reason most are getting in is because most who apply are actually applying under one of those exemptions, and so we've deemed that that's an appropriate way to enter the province. So we feel that a lot of people who would otherwise have come are not coming because of that, because of those restrictions put in place. And I think the numbers that you quoted, Premier, are correct.
Okay. I have a question about level 2 as well. And I'm wondering, when do you think you'd be ready to announce a date for that?
So I think we'll be, it'll be next week. It'll be later in the week that we're looking at. It'll probably be next Thursday that we will be next Wednesday that we'll be looking at that.
You mean announcing or?
Announcing, yeah.
Okay. And the last question was, I wanted to ask about temperature screening at airports. You expressed doubts about its usefulness, and the Chief Medical Officer Canada, or Health Officer, has also expressed doubts in the past. Why do you think the government is changing this now, and will the province be required to assist with it here locally?
So, I can't speak as to why the decision was made. I wasn't a part of the conversations, but certainly if anyone is going to be asked to do that, it wouldn't be public health officials. It would be officials at the airport who would be doing that screening with regard to temperature.
So, Peter, what I understand about that, there's actually 3 phases, and these would be people that would be coming into Canada from the temperature checks. Phase 2 would be people that would move from provinces, from one province to another, and then phase 3 within the province and so on. So, what we've seen this, showing up in many jurisdictions within the world. The federal government has made a decision that they want to use this device within airports as well. We're seeing it around many industries as well, but it's just really an indication of where people would be if your temperature rises. Given the health background, it could be for any health reason, but not specifically to this virus. So the usefulness will, I'm sure, researchers, and there'll be lots of papers written, but keep in mind the temperature of people could rise for any number of reasons. But for some reason, the federal government has made a decision to use this as a tool into airports as well. But there'll be a lot of discussions on how effective temperature testing is.
Our next questions are from Tyler Dunn of VOCM News. Please go ahead.
Thank you. As we're potentially 1 week out from moving to the second alert level, what will be the major changes, considering things like bars will reopen and physical distancing, since it's not enforceable, might go out the window, not only inside of those places, but outside them as well?
So there'll certainly be guidelines as to how that can happen safely, and I think many of the bar associations are engaged in wanting to follow those guidelines. I don't think anyone wants to be the place where the epicenter of another outbreak. So I think that businesses are engaged to ensure that they're keeping their customers safe, and that and their employees safe as well. So. Yes, there will be some challenges, I'm sure, but I think certainly everybody is really behaving or wants to behave responsibly, especially businesses want to behave responsibly and want to ensure that they can keep people safe.
Yeah, facilities, Tyler, you're right. I mean, most facilities are now open and services are being provided. I mean, of course, what's left now? I think we have gyms maybe, and places of worship is something I know we get a lot of questions about. So there's most places that are open right now, but under alert level 2. These are the things that will be considered. Then, of course, the size of gatherings. But public health officials will do the monitoring on this, and they will use the science, the evidence, and see what's been happening, and just look around, do the jurisdictional scans. Right now, it's these are the things that would need to be considered. So there will be feedback, as we just mentioned. I think the public health officials have been doing a really, really good job in getting those businesses ready to reopen. Places of worship is another example that I've just mentioned. So there's quite a bit of work that goes on behind the scenes in preparation for that decision.
Okay, and people are concerned about large gatherings of people in places like Bannerman Park, which was observed over the weekend, while things like funerals and weddings are still limited to 20 people. Is this a concern of yours, and how can it be addressed?
So I think what we've got to remember is that when you're in a park and you have, if you're in with your own group of close contacts in your bubble, and you're physically distant from other groups, this is a safe way to get out and enjoy the outdoors. And so we've always stressed that physical distancing is very important. And certainly looking at funerals and other ceremonies like this, that's something that we will be looking at with in the next alert level. So, but I don't think you can compare the two, because they're different situations. One is indoors, where we know it's not as safe and there's a higher risk of transmission. The others are outdoors in the open air, and if people are staying within their bubbles, and physically distance from other groups, then that's what we're recommending that people do.
So if you look
Okay.
at the
Sorry.
news that would come from other jurisdictions, we saw last week of a gathering of 30 people turned out to be 15 of those testing positive with COVID. So these are just examples, and I think all of us have the responsibility to use common sense. You know, as Dr. Fitzgerald said, if you're outside and you can actually practice, safe distancing, well, be responsible, because we know, all we need to know is learn a lesson from what can happen. We're in a great spot right now as a province, and we've been able to do that because of the population has been, fairly compliant to the measures that have been put in place. But, first and foremost, never take it for granted. We saw what can happen in another jurisdiction, and this is living with COVID in our province. So let's continue to follow those safe health guidelines that have been put in place, and that is where we will keep our province safe.
Thank you. And Dr. Fitzgerald, you talked a little bit about the virus circulating throughout our communities again. I'm just wondering, what would it take for this province to revert back to a previous alert level should we see a second wave?
So first of all, I will say that our goal is to not have to do that. So what we want people to learn, and I think this is a good opportunity now, we're seeing a time of low prevalence, we're able to get out and we're able to move around more, is to take this time to learn what you have to do to stay safe when it comes to COVID and the transmission of COVID. So maintaining your physical distancing, washing your hands, practicing those personal measures that can help reduce the spread of this virus is very important. Paying attention to keeping your contacts outside of your bubble as low as possible. Those things are very important. It would, we'll be monitoring the situation, and certainly if we start to see a large, number of community-acquired cases where we aren't able to pinpoint a source, or it's not due to travel, where that certainly would be of concern to us. We will likely see outbreaks as things, as if we have another wave and see importation within the province. We'll certainly see some outbreaks, and as long as we can control those outbreaks and we can keep, do the contact tracing that's required, that may not be a reason why we need to revert to any particular level, back to another level. But, our goal really is to keep moving forward and to not have to shut down. So I think if people keep in mind the, people, space, time, place, try to keep their risk as low as they can, so that even if we do get some cases of COVID-19 in our community, we won't see it spread to the point where we have to move backwards.
Okay, thank you.
And our final questions today are from Patrick Butler of Radio Canada. Please go ahead.
Border. Premier, you were in talks between the government and mayors in Lab City, Walbush, and Fairmont, as well as leaders in Quebec regarding reopening the border between Fairmont and Lab City, Walbush. Is that going to be the case soon? And if so, how will those measures at the border change?
Yeah, so when you look at those communities up there, there's been a close relationship with the community of Fairmont into the Quebec side and into Labrador West. Of course, if you're in Fairmont and you go through the airport, you have to go into Labrador West through Walbush. So that relationship, those close commercial ties and family ties, have been in place for quite some time. So what they're looking at there with the leaders in that community, what I've asked them to do is put together a proposal, some correspondence that could go into public health officials so that they can devise a way or suggest a way that they can actually do this safely. Of course, we must need to keep people on the checkpoints to supply information and so on, making sure that there's no one there, because you could actually get into or come into across that border from outside of Fairmont as well. So the discussions has really been about the relationship between the community of Fairmont and Lab West. Now then, by extension, of course, we move into Lab South, and we see almost the opposite. The airport's in Blanc-Sablon, which is on the Quebec side. The ferry from St. Barbe actually lands in the Quebec side. So it just shows the dynamic that we have to deal with as we let people in those regions move safely back and forth for a number of reasons. So the leaders there are cooperating, I must say. On the call that we had on Friday, we were complimented for the work that we've been doing and in the leadership that's been provided both locally and through the province in helping those communities move back and forth safely.
And just so we're clear, there's no date, no specific plan for reopening the borders, whether it be in Lab West, or for changing restrictions at the border, I should say, whether it be in Lab West or in Lab South?
Well, the changes, I haven't seen what the proposal would look like. This will come in from the leaders. That's what we asked them to do, to supply that information for public health. You know, what the idea here, the concept there would be able to get people from Fairmont to move more freely back and forth into Lab West. Very different conversation that we would have had, 6-7 weeks ago. It was at that stage is people were, in a position where they really wanted those borders shut down. So you can actually see now as people are now ready to actually reopen a little bit more and making sure that they can move freely back and forth through that border. So we'll just wait till the information would come in from those leaders, because it's important that you seek their input and have the information so you can get an idea exactly what it is they're asking for.
Why is it that we have to wait for proposals from people in those communities when the decision is ultimately going to come from public health? I mean, this is not a new issue at the border. There's been lots of complaints on this for quite some time. Why need to wait for a letter or some sort of proposal to come from them when there's so much time that could have been taken to consider this situation?
Well, I think if you listen to the comments, as I just mentioned, 6-7 weeks ago, it was a very different communication. At that point, there was a lot of people not wanting to see. They wanted to see that border closed up. Matter of fact, you'd almost put a gate over it. So right now, over time, it's changed. So it's not something that's not a decision or a discussion that people were having, wanting that border opened up, many weeks ago. Matter of fact, it was quite the opposite. Matter of fact, the essential workers that would come in to support the mining industry, there were some strict measures and restrictions that were put in place through Wildbush Airport. As an example, if an essential worker was coming in, they could not even go through the airport. There was a bus that would have picked him up. So there's been a lot of work working with the officials and those community leaders. So first and foremost, before the changes are made, you've got to make I think it's the responsible thing to do would be to make sure that you get the community leaders themselves in a position that they're willing to accept and agree to what those changes would be. Right now, they're asking for that. So it's important that we work with public health officials and make sure that you can do that safely, because one of the other things that will need to be considered would be people that would move from Newfoundland and Labrador from the island portion as they fly into Wildbush. If you allow, those that would come in from Fairmont into Lab West, well, it goes without saying that you should be able to move from the island portion into Lab West, likewise leave Lab West and come to the island portion. So these are all things that we discussed on that call. It was a great call and a lot of cooperation that's occurring. So they're going to put in a letter proposal, no different than you would see a risk assessment that would come in from a sporting group, an industry group, and so on. That's the way this will be treated.
Thank you.
Thank you very much for tuning in. The time for questions has ended. Please join us again on Wednesday, June 17th at 2 p.m., 1:30 in most of Labrador. Have a great evening, everyone.